Patient presentation, patient initials RL, date of birth 04/15/1969. Chief complaint of this patient is fatigue and sore throat. So this is an African American man who presented to the urgent care today. He came into the urgent care complaining of fatigue and a sore throat. So the patient appears tired and reports that he has been feeling run down for the past few weeks. He denies recent illness or exposure to sick, and upon further inquiring, he mentioned that he had a persistent sore throat for the past week, and it's accompanied by difficulty swallowing. He denies any fever. So his past medical history, he has hypertension, hyperlipidemia, sleep apnea, type 2 diabetes. The review of his past labs, his CMP sodium was 135, glucose 70, butane 11, creat 0.5, and his cholesterol 230, LDL 120, HDL 40. He has no known allergies. His current medication, he's on amlodipine 10 milligrams. He's on ibuprofen that he takes as needed for pain. He's on atorvastatin 80 milligram that he takes one tablet nightly. Review of his system, general appearance, he appears well nourished and well developed. His communication is normal. Cardiology, he denies chest pain or leg edema. Respiratory, he denies shortness of breath. He does report cough. Dermatology, he admits to rash on the left elbow. And endocrinology, he denies polyuria, polydipsia. Hematology, he denies any abnormal bleeding or easy bruising. Musculoskeletal, he does admit to joints pain and stiffness. And neurology, he denies headache and numbness and tingling. Urology, he denies frequency, urgency. Psychology, he denies depression or anxiety. So his physical assessment, vital signs, his temperature is 98.4, his pulse is 56, blood pressure 113/69, pulse oximetry is 99% at room air. His height, he's 6 foot, and his weight 251 pounds. So constitutional, this is an African American middle-aged man who appear fatigued and uncomfortable. The patient appearance, he's overweight with a BMI of 30.6. He appeared tired and exhibits signs of discomfort and with a slight pale complexion. He's seated with a slight slush posture and same fatigue. So his head is normal, eyes pearl, ears external are normal, TM pearl gray, nose, he does have clear discharge, and his septum shows rhinorrhea. His throat, lips, tongues, gums are normal. His tonsil, though, erythema, and uvula is midline. Okay, and his posterior pharynx, by looking at it, is erythema. Cardiology, his rate and RAM is normal. Pulse, normal pulse. Pulmonary, lungs sounds are clear bilaterally. Abdomen, normal bowel sound, soft, no tender. Lymph node, no swollen lymph node, musculoskeletal, normal range of motion, no edema. His skin is warm, dried, and intact, no bruises, no laceration. Neurology, mental studies, he's alert and oriented time 3, motor, no tremors, deep tendon reflexes, bicep +2 bilaterally, psychology, behavioral, his mood, attention are normal, no short or long-term memory impairment. So the labs and tests ICD included, no clinical diagnosis. Other diagnosis test, no diagnosis test in this case. The assessment, including the primary diagnosis and pertinent diagnosis with the ICD test and overall care. So the primary diagnosis that I would come up with for this patient, looking at his clinical presentation, the clear discharge, and the sore throat and the fatigue, I will come up with posterior rhinorrhea. And the ICD code for that diagnosis is RO.82, posterior drip. Okay, that would be my primary diagnosis. And the differential diagnosis, I have several. The differential diagnosis would be sore throat. And the ICD-10 for that diagnosis, differential diagnosis, would be G02.9, acute pharyngitis. Okay, and specify patient sore throat, and I will do the care instructions for sore throat. Also, another differential diagnosis would be exposure to COVID, to SARS COVID, and the ICD-10 code for that would be Z20.822, contact and exposure to COVID-19. And I will run a COVID rapid test, and the source for that test would be nasopharyngeal. Okay, and another differential diagnosis would be cough. Okay, and the ICD-10 for that would be RO5.9, cough, and specified. And I would do the care instruction for cough. Another differential diagnosis that I can come up with would be viral screening. Okay, we can test him for viral screening, and the ICD code test for that differential diagnosis would be Z10.59, level encounter for screening for other disease. And I will run the rapid flu A+B for that test. Okay, and it would be a nasopharyngeal test, and I will do the care instruction for that. So after running all these tests, the result for COVID test came back negative. The result for viral screening came back negative. The results for the tests that I've run for cough and stuff came back for negative. So the patient care instruction, what type of instruction would I give to the patient? I would tell the patient that he should consult our office if he developed a fever of at least 101, if he sore throat pain increases, or if he doesn't see any improvement 5 to 7 days, he should immediately call the ambulance or go to the ER if he have any trouble breathing, if he cannot control his saliva due to difficulty swallowing, have swallowing of the neck or tongue, and if he cannot move his neck or have trouble opening his mouth, he should immediately call 911 or go to the emergency room. Follow-up appointment, I will tell the patient we are urgent care clinic. He can come up anytime. He can visit our office, return to our office anytime. The CPT charges would be 93302. 93302. And my signature is when Lasida Wedrago.